My name is Boris Zevin, and I'm an associate professor in the Department of Surgery at Queen's University. I'm also the medical education scholar with SEAMO. I was fortunate enough to be awarded funding as an established educational scholar. First of all, I'd like to thank SEAMO and the committee who adjudicated the grant applications, and thank them for taking the time to do it. We are really working, this is a collaborative project that we're doing with the School of Computing. So I work with Professor Fichtinger from the School of Computing, as well as Rebecca Hinsey, who is a PhD student in his laboratory. And we're looking at ways of teaching technical skills to surgeons for open operations. And what I mean by that is we're not interested in the keyhole operations or the robotic surgeries that have become quite popular, but we're looking at ways of using technology and specifically using cameras and video recording to allow the computer to capture how a trainee is doing for an open surgical skill. And what we're focusing on is a groin hernia repair, which is a very common operation done by general surgeons. And we want to use this technology to be able to not only assess how the learner is doing and provide them with a score compared to what the standard is, but also to be able to automatically provide them with feedback in terms of how they're performing with the steps of the operation. And the big vision for us really is to be able to gather validity evidence for this technology, demonstrate and compare whether feedback from this technology, which we term open surgery tutor, whether the feedback from that technology is equivalent or at least similar to what you would get if you have a trained surgeon observing the learner in a simulation laboratory learning this procedure. And then we want to show that learners who are using this type of technology are actually improving their skills when they go into the clinical environment. So we would hope to take this from learners learning in a simulation laboratory and also then going into the operating room and being more proficient in their technical skills. So this project is going to span 3 years for us. We've already done a fair bit of initial work on the the computer assessment side of things, but the bulk of the work that's yet to be done is really comparing the feedback from the open surgery tutor to the faculty preceptors, and then demonstrating that the skills that the residents acquire in the simulation laboratory actually transfer to the clinical environment for inguinal hernia repairs. I think I've been at Queen's for the last 7 years, and the funding support from SEAMO has been fantastic. It's really allowed me to pursue a number of projects over the years, all of them revolving around the health professions education and looking at better ways of teaching along the continuum of health professions education. But I'm hoping that this will lead eventually to some additional external funding from possibly the Tri-Council, as it is in fact a collaborative project across different disciplines. And also it will definitely help with hiring researchers to help us along the way, and also helps facilitate us being good mentors to both medical students who are interested in this type of research, because then we can have a way of actually hiring medical students to work on this project over the summer. And we're also looking at ways of creating a fellowship in surgical education, which, for example, this funding can potentially support.